Hello, my name is Jill Berry Bowen, CEO of Northwestern Medical Center, and your host of the NMC Health Beat Show, dedicated to discussing important healthcare topics of interest to our community. Today, I'm joined by Dr. Kahren Aydinyan and also audiologist Stephanie Maloney. It's our new team for Northwestern Ear, Nose, and Throat. Welcome, and we've been waiting for you both a long time. We're so happy to have you here in this community. It's been a gap in service, and it's so much needed. So happy to have you, and I know the viewers are going to be excited.
Thank you for having us. We're excited to be here.
Yeah, it's terrific. So let's jump into it, and maybe for each of you, if we could just tell us a little bit about your background and experience in your profession.
Sure. So I grew up here in Vermont. I lived in South Burlington, and then went to college at UVM, and then I transitioned. And when I got to medical school, I went to West Virginia School of Osteopathic Medicine to become a DO, and then further, I went further out west to Tulsa to do my 5-year residency in otolaryngology and facial plastic surgery. So, but I've always wanted to come back to Vermont to practice, to my home state, and so I'm super excited to be here.
Yeah. Fantastic.
Yeah.
Thank you. We're super excited to have you.
So I went to undergrad at George Washington University in DC.
Okay.
I'm originally from Pittsburgh.
All right.
After school, I went to the Peace Corps in Jordan, and then I went from there into graduate school at the University of Memphis. Then I did my externship, which we have to do for 1 year for audiology. I went to Malawi to work in a hospital there, and then I came to Vermont because I heard it was beautiful. I'd driven through it before.
It's all of that.
Yeah, so that was where I had to make a big move, so I figured I'd come to Vermont.
So a doctorate in audiology. Mm-hmm. So what does that mean?
So it's a clinical doctorate. So I went to graduate school for 4 years, and we focus solely on diseases, disorders, how the ear functions, how your hearing mechanism functions. So basically anything from your outer ear up to your brain, how it functions, what it does. That includes the balance system, it includes how you hear, it includes sort of all the parts of your outer ear. So it's a clinical doctorate, so it's focused solely on that. That section of your brain. Yeah,
that's great. And you mentioned DO, and so what's the difference between a DO and MD as a physician?
That's a good question. So in the United States, you can become a physician, 2 pathways. So you become, you can go to medical school to become an MD, which is an allopathic physician, or a DO, which is a osteopathic physician. So there are actually more, I would say, similarities than there are differences. Both require 4-year medical school and then a residency into whatever specialty you want to go into. And then you can practice in the same exact professions, depending whether you're a DO or an MD. DOs also are taught to approach patients in a holistic manner and to see the body as a whole. And furthermore, we get about 200 additional hours of musculoskeletal training, which allows us to use our hands to further diagnose or treat common medical conditions.
Interesting.
Yeah.
Okay. Thank you for those descriptions. Helps us really kind of understand how this all works. So let's talk about your practice first. Where is it? Where will we find your practice?
So it's on the main campus
of
the hospital, Doctor Office Commons 10.
Okay.
So it's right on campus. It's accessible, lots of parking, and so we're both there.
Fantastic. So if you're going up Crest Road, there's a Doctor's Office Commons is on the right, and then there's a kind of that first wing, but you're the second one.
Correct, the second wing,
The second entrance to that in Doctor's Office Commons 10.
So,
terrific.
Yeah.
So what will you be doing there? So what do you do? What things do you see in the practice, in surgery? And so we can learn exactly what both of you do.
Sure, yeah. So as the ENT, ear, nose, and throat physician, I'll be doing a pretty wide breadth of ENT clinical practice. So I'll be seeing patients of all ages, so pediatric patients,
Oh, great.
so newborns all the way up through older adults. And the neat thing about ENT is that you can treat patients medically and also have the option of surgery if they need it. If they've either failed medical therapy or they need additional treatment to get them to where they improve their quality of life. Surgery is also an option, so so we offer that. And with Dr. Maloney here, we also offer hearing services, hearing test services. Yeah.
Okay, so that's your full scope. So
Yep.
you'll be working with the primary care. Where will you get your referrals from mostly?
Generally primary care physicians in the area, as well as pediatrics. We see a pretty wide, large part of my practice will likely be pediatrics. Certainly adults with any kind of sinus issues. Generally what we tend to see are kind of common conditions include ear, sinus infections, any kind of neck masses, thyroid issues, and any tonsil or changes in voice complaints.
Okay.
So a pretty wide breadth of ENT.
Okay.
Yeah.
Swallowing issues?
Exactly, swallowing. So we have tests, we have scopes to look at that, and certainly procedures, certainly if necessary, to correct whatever the issue might be.
Okay, great.
Yeah.
Super. And how do you complement this? So you both are in the same place. So how does this work, and how does your specialty complement this?
So they go together really closely because a lot of some of the issues that he sees with ears can cause hearing problems as well, and some hearing problems. People come in saying, "Oh, I just am not hearing very well." It turns out it's actually something that ENT can address.
Okay.
But so I'm doing just the hearing side of things. I also can see newborns through any age. So we can do hearing testing, like full diagnostic testing, starting when you're about 6 months old. So they're never too young to come in with a hearing loss. If you have any, concerns, we're always trying to push that for people now. I know people used to think that kids couldn't be tested until a certain age. You can be tested as soon as you have any concerns. So you can come in, see me. I do hearing aids and counseling.
I was going to ask you that. So.
Yeah.
What about hearing aids?
Right,
You do that too?
Yes, yeah.
Okay.
So we're going to be ramping up to doing that as we go along. So basically, we can work hand in hand to see how we can get to the root of the issue and get people out the door and doing better. So sort of, yeah.
So anything to do with the ears, the nose, and the throat.
Throat, neck, yep,
Neck,
exactly.
okay. And then the hearing piece, to test where your hearing's at and any hearing loss, hearing aids, and any support
Exactly.
to that.
So you can see either one of us independently, or we might need to be working as a team.
Okay, so you can come see each other independently. And do you need a referral to come and see you, or can you just, someone says, I've got a swallowing problem, or my hearing is feeling off, can you just do that independently?
That's a great question, actually, because I think a lot of patients would have that concern. I think a lot of it depends on certainly your insurance.
Okay.
And if they require a referral. If patients don't have that qualification where they need a referral, then I'd love to see them.
Okay.
And they could just make an appointment at that point.
Okay.
So we can definitely work with them to get them in and seen.
Great, great. Is there anything else that you want the viewers to know about what you do? And obviously we know where you're located, but what you do, anything else that you want to describe? You can think of?
Yeah.
Did we cover everything?
Yeah, so as I mentioned, we'll be seeing a lot of likely pediatrics. I know there's a pediatrician's office next door, so and if there are any acute issues that may occur where they go in and see their pediatrician and they may have an issue that requires attention emergently or right away, our office is very close, so they can just typically walk on down to the next door and to our office, and we'll take care of them. So
come right in. That's great.
So
making it convenient.
Exactly, convenience is key
accessible.
for sure. Yeah,
That's terrific.
yeah.
So you had spent a little bit of time in Jordan in the School for the Deaf. What was that like? That sounds like an interesting experience.
Yeah, it was really great. I don't know if you know, like Peace Corps is about 2.5 years of service. So I worked as sort of a teacher's aide and did, some teaching materials and helped with the kids. And that's actually how I learned about audiology. I thought I wanted to be a teacher for the deaf and learned that was not my calling. And then I met an audiologist and it sort of pushed me down a different path. But yeah, it was an amazing experience. And that's definitely where I got my passion for making sure that people with hearing loss can be fully integrated in their community and can be supported and, get anything that they need to live whatever life they want to live, because it's something that we have access to here that they don't have access to everywhere else. Right. So, I think it's something that is really important. So, yeah.
Well, my mom suffers from severe hearing loss, and so it's so it does touch my heart about the work that actually both of you do.
Yeah.
So it's so very, very important. Yeah. And how did you find your field?
So I found it actually in medical school.
Okay.
Well, before that, I actually myself had sinus surgery.
Okay.
So I've always known about ENT and that it was a specialty and somewhat what they did. And then I rotated through medical school and just fell in love with it, and that's kind of what I've pursued ever since. And ENT is a great specialty. We can see patients of all ages, which is great. You're not just seeing adults or kids, you're seeing all age groups, and the ability to offer medical and surgical treatment, which is great. So I just fell in love with it, and I've been happy since. Yeah.
That's terrific.
Yeah.
Now you have a little bit about the National Guard.
Yeah, I do.
So this is a little different twist
it's
here.
It's a little twist. So yeah, I joined when I was 17. I was still in high school, and I wanted more medical experience.
Okay.
So I joined as a medic in the Vermont Army National Guard, and have. Then when I spent some time with multiple units here, and then when I went to West Virginia for medical school, I was a transition over there, and also spent some time in the Oklahoma Army National Guard as a field surgeon, and finally then transitioned back to the Vermont Army National Guard here recently.
Okay.
So I've got about 17 years in, and I love what I do. Being able to kind of work with multiple professions and being able to serve my country, and so
That's
good.
terrific.
Yeah.
Wow, I'm so happy to have you both here.
Thank you.
And I'm sure the community has fallen in love with you just by listening to this. So as our time comes to a close, maybe a little bit personal, like what you do for fun or with your family, or how you stay fit and balanced for your work. Since we live in the Rise Vermont country, we want to make sure everybody's living healthy lifestyles. So maybe a bit about each of you.
Yeah. Like I said, I'm new to Vermont. I'd never lived in Vermont before. I hadn't been here really extensively before, and I moved solely based on pictures of how beautiful it is. So fantastic. I have a dog. So we so we go pretty much every weekend somewhere different to go hiking, go to different lakes and stuff. So it's been beautiful so far. It's lived up to the hype for the month or so that I've been here. But it's been great. So
super.
Yeah.
Excellent.
Yeah, it's fun. I grew up in Vermont, so I'm always trying to stay active. Since I've been back for about a month now. So I've climbed Camel's Hump, which I was excited about to get back to
beautiful.
Climbing the mountains here, and I've done some other hiking and spent some time at the lake, which is always a good, trying to get out there and enjoy the summer while
we've had some
here.
great weather, so I hate to see it go, but we have some great weather.
So it's been great enjoying the Vermont summer while it's here.
Super.
So, yeah.
Great. Well, thank you both. You've been wonderful guests, and it's great to be opening Northwestern Ear, Nose, and Throat. So thank you very much. I'm Jill Berry Bowen, CEO of Northwestern Medical Center, and so pleased to be having this conversation that Northwestern Ear, Nose, and Throat is open. We've been waiting for this day to provide this much-needed service to this community. So thank you for joining us today.